Yes. Well, thank you again. Thank you again to Alex and Professor Chan and all the other ones organizing this event. What I was just thinking also, what it's amazing is you in Hong Kong have been able to bring together researchers, leading researchers like Professor Riva, Gagioli, and others who are advancing this work all the way from Europe, some online, some in person, something that we haven't been able to achieve locally, no? Although we are so much closer, Milan and London and people from Germany and Spain, they're so much closer, and we haven't been able to do that. And you were able to do it in Hong Kong. So congratulations for that. Well done.
Thank you. Thank you.
So this second part will be more focused on current projects we have in the lab. So some of the projects that I mentioned before were from my work in the lab when it was based in Sydney in 2019, just before COVID. I moved to London, but the focus of the lab has stayed the same. So I will be talking a little bit about design research. One new area of work that I've been focusing on has been AI ethics, and of course mental health projects, and the projects have slightly changed, also the set of technologies, type of technologies that I'm using, etc. This is my current lab. The photo doesn't have everyone, but here we have academics and colleagues and people from very different disciplines. So I wanted to use this to show how interdisciplinary our field of positive computing or positive psychology is. So in my lab, we have I have researchers that come from design research, computational linguistics. I even have the first philosopher being hired at Imperial College London in engineering, but his background is in philosophy, and he's helping us on projects in AI ethics. We have people obviously with focus on machine learning, computational linguistics, psychology, etc. So you need to have a very interdisciplinary lab and have collaborators obviously with expertise in many different areas. Again, the focus of our lab has and will be that all technologies should be designed to support psychological well-being. And this is not as obvious as you will imagine, because, for example, when you're designing an app for asthma, sometimes the focus is on the physical health, it's not on the psychological health. So what this message says is that even when the focus is educational, the main focus is educational, or the main focus is physical health, we need to be taking into account the impact that technology will have on the psychological health, the psychological well-being of the individual. And to do this, we have looked at different levels, if you want, of abstraction of how our engineering work will have an impact. There's a social impact. So I have been increasingly working with, like I said, philosophers and policymakers, looking at the impact of AI on people's psychological well-being. And this has to do with policy, corporate practices, but also engineering, education, and public discourse. There is a level where, as an engineer, I build applications, I build products. So in this case, I've been looking at health. Most recently, most of my work is around health. But I do work with colleagues whose focus is more towards education or sustainability. And in my new school, a lot of people are looking at manufacturing. But all of these things, to me, can only work when we have a very strong foundation, when we have, in my case, a foundation on design research, on engineering, but also obviously psychology and business and innovation. These are the core fundamental disciplines or bodies of research that give substance to the sort of work we do. No? So for the foundations, some of the work that we've done is around affective computing or more design research around the book on positive computing, etc. Some of my lab also bring expertise on user experience and cybersecurity, because when you manage large data sets of health data, for example, you need to focus on this. And of course, the research that I described before on methods, tools, instruments that we can use to improve motivation, engagement, and thriving in user experience. And this is the methods model that I discussed in detail in my previous presentation, looking at the different spheres of experience. Again, my lab aims to bridge from this foundational level, all the research from psychology, user experience design, sometimes affective computing, or all these foundational disciplines, and bring them into actual products that can be used as case studies of how positive computing can be introduced into the practices of larger companies and so forth. Our products in general are not products that we commercialize, although we do license them to organizations that then maintain it, either mental health or charities that work on asthma and so forth. So one of the products, if you want, that we have created, it's for design researchers or people creating new interventions. These design for well-being workshops have activities that help designers go through the design process in ways that take into account these basic psychological needs. And then in the next session, in the Q&A session, I'd be happy to discuss this in more detail if some of you want to try them out. This session for me, it's mostly about our projects and products, so you can see some of these case studies. So you can see how we have brought positive computing techniques or positive technology techniques. For me, these two are synonyms. How do we bring them into actual design practices? So I did talk a little bit about Kiss My Asthma. This is a play of words, obviously. We had a campaign on Facebook inquiring about the name from adolescents, and they came up with the title. Obviously, it was kind of hard to convince the lawyers to accept the name, but I think it added to its success. So it's partially an example of how co-design, even of the name, can be useful to be able to connect to the target audience, in this case, adolescents.
Yes, okay.
So as I mentioned before, we do a lot of co-design work with adolescents, and we ended up building an app that supported these psychological needs, had the specific features for supporting each of them. Now, we have brought what we learned in this project, that was for targeting adolescents with asthma. We have brought this into a new project this year, working on conversational agents. This one is called Brisa, and it's basically a WhatsApp chatbot that calculates the risk of having an asthma attack. So you can go to WhatsApp and it will ask you a number of questions, and using a model that we have created with the data from 1.8 million British people, this comes from the centralized electronic health record system, we can calculate, we have a very accurate statistical model of asthma, and we can calculate the risk of a person having an asthma attack in the next few weeks. We also have incorporated voice. We are looking at how voice can be used to detect the risk of asthma from the breathing patterns. So we are looking at how we can help people without them having to install a particular app. Now, WhatsApp is a tool that 80% of the population uses in many countries, and we are trying to incorporate this in a way that is very accessible. So here we have also looked into how we can support psychological needs. For example, autonomy is because we can provide personalized feedback. We can help them set up their own goals, symptom goals, analyze their personal, their voice, calculate the risk about themselves, for themselves, etc., as opposed to something that is a generic tool. Like if you were using like ChatGPT or those systems don't use personal information. Then we wanted to support people's sense of competence by improving, making it easier to communicate with the chat assistant. We give the option of using WhatsApp or something on the web. People can track and learn about their systems. Learning about their personal situation is a very important motivational driver that supports a sense of competence. Identify what factors trigger the symptoms, and so forth. These are all elements, functionalities that help support the person's sense of competence. And then finally, we'll look at how relatedness can be supported in different ways with reminders and so forth. I should mention here that we are working together with the UK's Asthma and Lung Foundation, a charity that provides feedback to their stakeholders using WhatsApp. So eventually we will be integrating the two platforms. In another project, we are working, or we have two projects actually on dementia. I will be talking about two of them now. On one of them, it's based in the UK. It's through the Dementia Research Institute. That is a very, very large initiative, maybe one of the largest in the world, studying different aspects of dementia. My particular project here is looking at a number of houses that have been instrumented with sensors, all sorts of sensors. So we have a house, I'm going to be showing you in a second, that has sensors for sleep, sensors in the bed, sensors in the doors, in the fridge, in different devices in the home, etc. All this data can be used to detect and track people's behaviors in the house. So we have about 120 houses now instrumented with these sensors. So these are 120 households where at least one person has dementia. Generally, the people live on their own and they have a carer that comes on a regular basis, or they live with their partners. So this has obviously big challenges about managing data, but I'm particularly interested on the user experience because, as I mentioned before, we don't want people to be surveilled. The goal of these interventions is always to help people live independently as long as possible. And we need to understand how to support that sense of independence, of autonomy. So we have a platform called the Technology Integrated Team. In this particular, this was the first part of the project. The researchers working on that track 400 people with dementia and their carers. They collect the physiological data from sensors, etc. And then the machine learning algorithms can help us monitor the daily activities. My lab work a lot on the user research, helps in the creation of the products, not trying to understand how to best create these products. We have co-design activities with people living with dementia and their partners and other stakeholders from the clinical teams, etc. So this is what we will call human-centered design that helps us understand the user needs, the user experience. We develop personas and use other techniques that allow us to create profiles and then features for different profiles of people. We do a lot of prototyping that we can share with our stakeholders to get responses and then iterate on the designs. And all these methods, I think, are time-consuming on the one hand, but help us build better products. It's best industry practice. But within the context of dementia, this brings a lot of big challenges about understanding and communicating with these different groups of stakeholders. So they have different issues. We have issues, of course, of ensuring safety, security of the data, but particularly challenging and difficult and unique in this group are managing activities of daily life and emotional challenges. So when your husband or wife has dementia, this is not only a problem for the person with dementia, it's a problem for the family, right? So we need to provide support to the whole group. One of my students, for example, has developed mindfulness interventions on Alexa. So the people will have, or all of these households have Alexa devices, and we have developed a mindfulness intervention for the dyad. So the intervention is about mindfulness practices that help people deal with anxiety and depression, but also in connecting the dyad, the two people in the house, the husband and wife who might be distancing from each other due to the illness. And we want to build practices that help them come together and feel connected for as long as possible. So in the house, as I mentioned before, we have all sorts of sensors. We have physiological sensors. We're using Withings thermometers and blood pressure monitors, scales. But we have, more importantly, most of my work has been on the environmental sensors, passive infrared sensors, door movements, checking when the person goes in and out of the house, smart plugs that allow us to see if the person has turned on kettles or use different devices, and then sensors in the bed that allow us to see when the person is sleeping or not. So here you can see some of the locations of these sensors, and then the big data collection happens on and is presented in a system called Minder that the DRI has been developing and is accessible by the clinical team. So this allows that when something happens in the house, the clinical team can react quickly. So I was going to show here a video about the system more in.
Hi, welcome to the UK DRI Care Research and Technology Centre. Come on in.
So that video showed the living lab. This is a prototype of the houses, but as I mentioned before, we have over 100 houses that have been instrumented, not with all these sensors, but with a lot of them. And of course, each household has its own complexities because obviously over a period of time, family conditions change. Sometimes the person regrettably obviously dies or has to move to a hospital and so forth. But we use this during COVID, and in a research paper we published in Nature, we looked at how during the COVID period behaviors in the households change. And we can do this because we have these houses that have a lot of behavioral data, and this allows or could allow in future pandemics for policymakers to have a better understanding of what the impact of their regulations is on people of different age groups, or particularly disadvantaged groups like it is with people with dementia. Now, this particular project I just showed you obviously requires a sort of infrastructure, a sort of investment that is possible in Hong Kong, in the UK, and other developed countries. But if you wanted to apply these methods in low and medium income country, that's much more difficult. So in a second project, we're working to support people with dementia and their carers as well, but in Peru. And this has a completely different set of challenges. So just to give you a sense of the complexity, similar to other countries, the number of people with dementia will only increase. This in Latin America is predicted to go from 7.8 million in 2013 to 27 million in 2050. But one challenge that is very unique in Latin America and low and medium income countries, there's low public awareness. Most people don't know much about dementia. Sometimes very stigmatized. So sometimes we don't talk about dementia. It's talk about, we use the most common type of dementia, Alzheimer's, because it's a name that it's less stigmatized. There is limited access to trained healthcare professionals. There's inadequate cognitive tools that can help delay the progression of the illness, or there's absence of the access to biomarkers and other sorts of diagnostic tools. So my team is part of a larger project looking at developing an app for collecting diagnosis data and then providing support to people with dementia and their carers. So we have 4 sites, each of which has completely different realities, different cultures. In fact, some of them, although they are all based in Peru and the main language is Spanish, we have one site in the Amazon and another one in the Andes, where they speak indigenous languages. So these are poor communities in a country that is all low income. We have one on the coast, and then we have Lima, that is a very, very large city. So these are 4 different cultural, socioeconomic realities. And this, for design researchers, brings a lot of challenges because we need to understand how to design for 4 types of groups that have some things in common, but a lot of differences. So one of the tools, we're building a diagnostic system. We will have 100 community health workers that will be working, knocking at doors in each of these 4 sites. So this brings a lot of working with communities. My 2 researchers, team members working in this project will be visiting these towns, talking to the community health worker. A lot of them are people from this, well, all of them are people from these communities, so people who are part of the culture and understand the end users, and they're known there. Although we pay them, the motivation, we think, should not be about the salary, the payment, but it's more about maybe contributing to the community. We are trying to understand how to help them be intrinsically motivated, how to build a technology that motivates, let's call them employees, to do this kind of community health work that is generally very low paid. And it's something that we cannot change. That's the situation in Peru. So we have to think deeply about how to do that. So the app that we are building provides them with information, obviously educational data or content that helps them understand the illness and the communities better, but also that helps them with the logistics, making it easier to go about their jobs, that makes the more that highlights the achievements and the impact that they're having on their own communities. We are looking at all the elements that could help them be motivated. So it's again about bringing the principles of self-determination theory, particularly looking at the continuum that I mentioned in my previous talk, from amotivation, when the person is not motivated, to intrinsic motivation, that they do it because they enjoy it. Somewhere in the middle, like I mentioned before, we have external regulation. Some of our health workers could be doing it just because of the salary, but we want to make sure that they do it as much as possible due to more internal drivers, because we think they will be doing a much better job. At the end of the 4-year project, we will have collected data from hopefully over 32,000 older adults across these 4 communities. And this is a really, really big challenge. It's a lot of data that needs to be collected and requires a very good understanding about the communities and how to build technologies that support the well-being, not just of the individuals, but the communities where they live. So we are looking, we have been doing co-design activities with people from Peru, people from the UK. This is funded by the UK government. And in these sessions, we explore, so some of them are end users, so people whose family has had dementia, died in this case of dementia, clinicians, social workers, and so forth. So we have done a lot of work. This one I mentioned before on youth work, but now we are also looking at not just English culture, like in this project I mentioned before, but also how we can apply this to other sorts of communities, particularly using things like chatbots, etc. So already in the Reach Out project, I hadn't mentioned before, we did develop and explore how conversations can be used to support the mental health of groups. And we also have headgear that I mentioned earlier. Again, you can download it from the App Store. In this project, we also follow a very user focus. So we did a lot of discovery and user research, workshops with end users. Then we did the wireframes and actually build the prototypes and eventually run the randomized control trial. So to do this, you need a very interdisciplinary group. These are slides I mentioned before, some of the focus groups and co-design activities. The features that we ended up with. Now, I'm showing these slides again. There's a little bit of redundancy to highlight the impact that this will have on the communities, end communities that we work with. And this has highlighted to me the AI ethics issue. So when you bring chatbots or when you bring any type of technology, we have to be very conscious about the ethics of the projects that we work in. There are initiatives. As an engineer, I'm part of the IEEE, Institute of Electrical and Electronic Engineers. There are initiatives in the IEEE. There are initiatives on many government and non-government organizations I'm co-lead for the Liebenhume Center of the Future of Intelligence. That is a large center based Imperial, Cambridge, Oxford on AI ethics. So there are many different initiatives. Out of all these initiatives, especially last year or 2 years ago, when this started becoming more broadly addressed, each of these organizations created their own principles. But some research has shown that the principles created for AI ethics, and there's more than 100 right now, converge to 4 that happen to be the biomedical ethics framework. So if there are people out there who have a clinical background, you will know that principles, biomedical ethics principles include well-being, supporting the well-being of your patients. In the case of medicine, it's a core principle, but also human autonomy, supporting human autonomy is essential for anyone in the health profession. Do no harm, and justice and fairness. So these principles drive the whole disciplines, the biological or clinical disciplines. And what we are finding in AI is that they also should be underlined, should be principles that we bring into all our AI design practice. But as you can see here, the 2 first ones are the ones that we have been focusing on in my previous lecture. So designing for well-being and designing for human autonomy are essential to the biomedical ethics framework, to the AI ethics framework, and generally to positive technology, positive computing. So it's something that we need to be paying constant attention. But things like ChatGPT, some of the new technologies have also raised the concerns that some of these technologies could produce harm. No, we are aware of many technological advances which have had unintended consequences and have produced either ecological harm or social harm. And we want to be able to prevent that. We want to be able to prevent things that happen in let's say, the first industrial revolution, where the impact of that new industry, of that new technology, produce an effect on the environment, no, on the sustainability of these advances. So with AI, we want to be able to predict and anticipate some of these unintended consequences and reduce harm. Part of the EU AI Act, the European colleagues there might be aware, it's in the process of being approved. It's a lot, or it's mostly about reducing or anticipating possible harm. So we have been working with companies and colleagues, philosophy and social sciences, on approaches to reducing or anticipating potential harm of new technologies. And finally, something that is really important to me, coming from Latin America, but also being concerned about minority groups or people who have had particular disabilities, etc., is justice and fairness. So we need to be able to build the AI systems that address some of the inequalities that are constant around society. So this is something that we have to be paying attention to. And it does have an impact on well-being. So it's very related, I think, to the positive psychology and positive technologies view on technology design. So because in my work as a design engineering, we pay a lot of attention to design processes. So you will have seen in my 2 lectures that I keep coming back to what methods we use to produce certain technologies. I think the methods matter a lot. No, it's not just the outcome; it's how we get there matters a lot because you will get to different type of outcomes if you follow different methods. So this is the double diamond. It's a very commonly used design method that it starts with a divergent approach to using research, and then you look at convergence, understanding the problem and having insights. And we have incorporated ethical and well-being analysis to this more quite standard, if you want, design method. And then we have a stage, added a stage that is about the evaluation. Obviously for us in health technologies, this is often a randomized control trial or something that helps us measure the impact that technology has on health. But it doesn't have to be just health. In our headgear project that I mentioned before, we can also measure the impact that it has on work performance. In my next talk, I'm going to be talking about 2 mental health projects that we have in China. And partially, obviously, is driven by our intention and ethos that all technologies should support well-being, including workplace technologies, but also looking at the cross-cultural aspects that we need to increasingly focus on when we think about positive technologies. So with that, I finish. Thank you very much.